Well, now to a health issue that is a particular concern for students and young adults. There have been 3 cases of severe respiratory illness linked to e-cigarettes in Clark County. One of those cases affecting a person under the age of 18. We want to discuss the risks of vaping, the symptoms that should be of concern, and the efforts underway to help teens understand the dangers. With us is Dr. Michael Johnson, Director of Community Health, as well as Malcolm Allo, Senior Health Educator. Both are with the Southern Nevada Health District. Thank you for being here.
Thanks for having us.
It's a serious topic, we want to talk about it. Dr. Johnson, severe respiratory illness, I think we're all hearing it more now. What is that?
Well, what we're finding are that, as you mentioned, we've had 3 confirmed cases here of individuals who have either been vaped, 2 have actually vaped THC, 1 has vaped nicotine. And we're finding people become hospitalized with severe breathing problems as a result of this vaping. So we're seeing across the country this happen. We've had 530 probable and confirmed cases around the country in 38 states, 1 territory, with 7 deaths. The kind of symptoms that are being presented are respiratory symptoms such as shortness of breath, cough, chest pain, and gastrointestinal issues, symptoms such as nausea, vomiting, and diarrhea, and in some cases fever and weight loss.
Wow, and those are not, you're thinking for a lung issue, you wouldn't think necessarily vomiting or something like that, so it's something you have to keep your...
Something we have to keep our eye on, and the CDC as well as SNHD is currently looking at, of course, what are the causal agents for this. We're pretty certain that it's not an infectious disease issue, but we're fairly certain it's a chemical issue. And there's a lot of chemicals in the makeup of both THC vapor and e-cigarette vapor.
Right.
One in particular that's being looked at is vitamin E acetate, which is a cutting, thickening agent that's used in THC liquid and can be vaporized to a high temperature but returns to an oil state when inhaled in the lungs.
Oh my gosh.
So
crazy. Malcolm, let's talk to you. So do we know how prevalent vaping is among the kind of the teenage group here?
Yeah, it's an epidemic. It's an epidemic.
Okay.
So in the last year alone, vaping increased by 78% in the nation. And when we talk specific numbers, in 2017 it was at 11%, 2018 we're at 20%, and just released 2019 is 25%. And when you compare that to our local data here with combustible traditional cigarettes, our smoking rate for teens here in Las Vegas is 5.4%. So when you're seeing our combustible smoking rates at 5.4%, but the electronic vaping rate at 25%, it's alarming.
Yeah. How do you attack that? Do you go to schools? Do they listen to you when you say it's dangerous? I think people know that, but you got to try, right?
Right. So actually, I'm going to correct that real quick. It's a lot of people don't know it's dangerous. When electronic cigarettes and vapor products hit the market, it was sold as something that it was not dangerous or the alternative to smoking cigarettes. Like Dr. Johnson just mentioned, there are a variety of different health concerns now that are popping up. So my job working with teens in the school district is to educate them and correct the myths surrounding vaping products and tell them that it's not dangerous. I mean, it's not safe and they should quit.
And what was the advice? If you're not vaping, don't start?
Yeah, I mean, our advice is if you're not vaping, don't start. And certainly youth, young adults, and pregnant women should not start. Generally, if you are vaping, we'd advise you to quit. And if you need help quitting, our 1-800-QUIT-NOW number is available to help you with free cessation services.
Right. So again, if a parent is home, they notice maybe their son or daughter coughing a lot. When do you know when it's not a cough and when you need to go see a doctor? I guess is the question, because...
I mean, the symptoms that I mentioned, if one or more of these symptoms are occurring, I'd err on the side of going and seeing your medical provider.
Okay, yeah, wonderful.
But it's important also to notice that these parents have to recognize what the devices look like.
Oh my gosh.
Because a lot of these devices look like USB drives or they're concealed as mints and pens and whiteout. So it's important for parents to understand if their kid is even using the product. Once they are identified as using the product and they have these symptoms, then they should seek help.
And it's so different from when I was in high school, which was a long time ago, because you don't smell it. Parents could always tell if their child was smoking because it would smell. But I don't think they smell. Vaping doesn't necessarily smell.
Well, they smell good.
They smell good.
That's exactly.
And the second problem is when you smoke cigarettes, you have to finish the cigarette.
Right.
When you use the vape product, you can take a puff and put it away in your bedroom.
Right. Wow, good advice, and I thank you so much for helping us understand it, and I know a lot of people are going to want to get more information. If you would like additional information about the dangers of vaping, ways to stop, or other anti-smoking programs, you can actually contact the Southern Nevada Health District. Their main phone number is 702-759-1000. You can also go to snhd.info for more information.